Hey everybody, we are going to talk about prescription drugs and the principles of writing prescription. This is a PowerPoint that normally physicians see, but it's just as important for pharmacy techs and pharmacists to see because it shows a complete prescription and what it takes to make a complete prescription. So let me open up the presentation and let's get started. So it's very important that you know all of the properties of a correct prescription. And if you get a prescription that is incomplete, that you send it back. You don't ever want to try to interpret a prescription or try to figure out what a doctor's saying, whether it's written or electronic. If all the pieces aren't there, it needs to go back for clarification without exception. So prescriptions have been used since ancient times. They actually found it on papyrus from ancient Egypt. Latins adopted it as a standard language, and RX is what stands for prescriptions. What is a prescription? It is a drug that requires a physician to prescribe it due to potential side effects, harm, or other reasons that it needs to supervise, and there needs to be supervision related to taking a medication. The FDA determines what are over-the-counter and what are prescription drugs, along with pharmaceutical companies as well. But the reason behind those, and the reason why sometimes prescription drugs become over-the-counter drugs, is because after a certain number of years, they feel like there's enough continued study that drug can be safely given over-the-counter. But prescription drugs, basically the FDA says, yes, they've been approved, but we want the person taking them to be monitored. Or we only want them prescribed for a limited amount of time. So the definition of a prescription, prescriptions can be electronic, written, or verbal. I'm going to tell you that verbal, we take them still, but we are moving further and further away from verbal prescriptions and verbal orders, simply because sometimes it's hard to get them signed. Sometimes they can be misinterpreted. And we are moving more and more and more towards electronic orders. So a practitioner, that could be a doctor, a nurse practitioner, a PA, an MD, DO, a dentist, a veterinarian. They all can write prescriptions. And so that prescription is then sent to the pharmacist for a particular medication for a specific patient. So once the pharmacy receives that prescription, sometimes the tech is the first person that sees it, and they may prepare it for the pharmacist's approval. But once again, if you are unable to determine all of the pieces of a prescription once we get through this, it needs to be sent to the pharmacist for review, and then it needs to go back to the provider. So once again, practitioners can be physicians, veterinarians, dentists, PAs, nurse practitioners, and physicians can include MDs and DOs. So prescription formatting, it should have a heading, a body, and a closing, just like a paper, just like a paragraph. It should have a heading, a body, and a closing. I would remember that the three parts of a prescription would be a heading, a body, and a closing. So the heading should have the physician's name, address, telephone number, and their prescriber number, which in the state of Texas is a DPS number. And then it should have, if it is a controlled prescription, it should have a DEA number as well. It should have the name, the age, whether it's a male or a female, and the date the prescription is written. So it should have the name of the patient, whether they're male or female, and their age, either their date of birth or age and numbers. If it is a controlled prescription, it also must have the patient's address on it. And then the date the prescription is written. If those things are missing, send it back, because you're billing for incorrect documentation. Now, the patient's name and address, most of the time it'll have first name, last name, and a middle initial sometimes. We ask that because there's a lot. At my pharmacy that I go to, I know there are 2 Jana Cruzes. So you want to make sure that there is a full first and last name that you can read. Also, if you have two people in the system, say you have two Jana Cruzes, then you want to ask for a middle initial. If they have the same middle initial, you want first, middle, and last name. Also, another thing that a lot of pharmacies want is a date of birth. It's not required, but it's very beneficial. And most electronic records that I have seen and have worked with, it has that on the prescription. It has the patient's first and last name, their address, their telephone number that they've provided the provider, along with their date of birth. That is all just below the doctor's name and the address of their practice, along with their DEA and DPS numbers. The content of the prescription. Once again, it should have the practitioner's name, address, and phone number. You need to validate the prescription and contact the information. Always, and I can't stress enough, if you don't have all of the information, contact the prescriber. If it's a new doctor in town and he doesn't have all of his information on there, or you think it might be a bogus prescription, then contact the provider. I will tell you, you will encounter prescriptions that patients have altered or that are completely false, which is another reason we're moving further and further away from handwritten and more to electronic prescriptions. The day the prescription is issued is important because most prescriptions are only valid for 30 days, which means if you don't fill it within 30 days, normally Normally, if you don't fill it within 30 days or take it to the pharmacy within 30 days, most pharmacists won't honor it. Also, if I was a provider writing a prescription for you and I wanted you to start it today, and I'm going to give you 6 months worth of refills, and then I need you to come back in, I don't need you to wait 30 days. I need to know that you're taking it. Also, if they're gonna give me 6 months worth of refills, but I have to come back in before I get more, that makes sure that I'm being followed up on, that they're following my progress on a medication. So you have to let a patient know if they call in for a refill, you as the tech need to say, well, you have one refill request remaining. We'll send this in, but you may want to contact your provider and see if you need a follow-up. It's always important to remind them. My pharmacy will put a pink note. When I have one prescription refill left, they put a pink note in my bag with my blood pressure medicine to let me know, hey, you have one more refill. You need to be sure you contact your doctor. So it lets the patient know, hey, you need to follow up. Now, this is what a common written prescription would look like. So you see it has the doctor's name, the address. I'm a little concerned about this one because it actually has someone at an apartment. 3 Towers, apartment 107A. That's a little concerning to me because it's an apartment. It's a doctor working out of an apartment. But it gives an address. So those would be things you would be looking at. If that's on there, might be a red flag. It gives the doctor's telephone number. It gives a place to put a DEA number. And in the state of Texas, in the center of that, you would have a DPS number as well. All Texas prescribers must have a DPS number. Then the patient's name, their age, or date of birth may be on it, their address, and the date of the prescription. In the middle, where you see the little RX on the left, that's where they're actually going to write the signature of the prescription, what they're going to be doing. At the bottom where it says label, and it has how many refills that may be done. Also, it will say whether or not the physician or provider should initial whether or not it's okay to substitute for generic medications. Yes or no. So that is what a common handwritten old school prescription would look like. I'm going to show you guys some examples of electronic prescriptions as well. So now let's talk about, that's what the heading should look like. Now let's talk about the body of the prescription. That's where we actually see what medicines are being ordered. So the RX symbol may be there, and it will have the name of the medication. So it may say Tramadol, the dose size, 50 milligrams, and maybe it's 50 milligrams in 10 milliliters of the drug. Dispense 240 milliliters. Patient to take 1 to 2 teaspoons or 5 to 10 milliliters, Q 8 hours. PRN pain. Then it needs to tell how many refills are available. So in the body, that's where the actual meat of the prescription is. It tells you what the medication is that you're going to fill. It's going to have the milligrams or milliliters, or it's going to have the dosage in there. It's going to have the number that you need to give, and then it's going to tell the patient how often to take it. So it may say amoxicillin, 250 milligrams, 1 PO, which means by mouth, 3 times a day for 10 days, number 30, and then they may say no refills or refill times 1 or whatever. So that's what we're going to look at. And so when we look at that information, we've got to make sure of some things. First, we've got to check and make sure that patient's not allergic to it. We should have the patient's allergies in the system at the pharmacy. If it's not, then we need to ask the patient, are you allergic to penicillins? Are you allergic to any medication? And I'll tell you, it happens. Sometimes patients will be allergic to penicillin, but the doctor will prescribe them Augmentin. Augmentin has penicillin in it. So we have to be aware of a patient's allergies. Also, is it available in our pharmacy? Do we have enough to refill it or to fill it? Do we have the medication to fill it? And then we need to be prepared to discuss cost with the patient. If the patient doesn't have insurance or it's a non-formulary drug, it may be very expensive. And if we don't have it available or it's going to be more than the patient can afford, if it's not available, then we can actually contact the pharmacy for the patient. If it's too expensive, we can contact the patient or the provider back and say, hey, is there an alternative medication we can prescribe this patient? They can't afford it. And sometimes we can get them a more affordable medication. So as you can see here, this has 3 prescriptions written on it. Now I see what looks like ferrous sulfate, 300 milligrams, number 100, 300 PO TID. And then it looks like Zendeal, 20 milligrams, 1 POQ. I don't know. So this particular prescription, I literally would send that back because I can't read it well. I mean, I can read the Humulin N, 30 units sub-Q, QH. Well, see, I can't even read what is after Q. So I would send this back for clarification because it's difficult to read. Okay? There's no age on it. There is a date on it. Raymond Vasquez, I can read that. But I can't read some of the prescriptions. So I would send that back and say, I need clarification. Now, also be sure when you are looking at this, there is a huge number of look-alike, sound-alike drugs. And there's also a lot of drugs that have been reformulated, like Sertraline and Lexapro. The Lexapro is just a little bit of reformulation. So we have to be aware of what's going on. Also, drug marketers are horrible about trying to utilize an established name, and then Nexium has done that. You know, they added one little inactive ingredient, and they changed the omeprazole to Nexium and continue their patent, and now it's still an over-the-counter drug. Also, companies will make combo drugs, like an Alzheimer's drug. Now, a newer one that they have now is a combo drug, and it's Namenda and Aricept in one pill. Or it may be Genumet, which is Januvia and Metformin, and that is 2 medications compounded together for diabetes. So we have to be real careful because sometimes a patient's prescription won't cover 2 separate medications. I won't cover a combo med, but might cover their 2 separate medications. So they may not cover Genumet, but they may cover Januvia and Glucophage, or Januvia and Metformin. Metformin and Glucophage. Glucophage is the generic of Metformin. So they may cover them that way. And so in that case, we need to look at that and make sure that our patient is getting medications at the best cost, that they're not just filling it because the drug rep said, oh, this is great. It's easy for the patient to be more compliant. Prescribe it, where it's going to be a huge cost to our patient. Also, we want providers and staff to avoid using abbreviations as much as possible. There are things you're not going to get them to not utilize. Like their doctors are always going to write PO, SL for sublingual, PR for perirectal for a suppository. They're going to use some abbreviations. But there are some abbreviations, HCT, they're not supposed to use. MSO4 for morphine sulfate, they should not be using because MgSO4 is magnesium sulfate, and they can be easily, there's too many ways to have confused abbreviations when doctors are writing things by hand. So we like for providers to use the least amount of abbreviations possible. These are abbreviations we don't use at all. You guys look at that list of dangerous abbreviations, acronyms, and symbols and know it. Okay? Because it can be you can very easily cause some serious problems with patients. Like IU for international unit can look like IV depending on how they write it, or 10, or 9. Maybe they think it's the Roman numeral 9. Units can be mistaken for a 0 that's not closed up, or sometimes the way they write it, it looks like a 4. And like I already pointed out, MSO4 and MgSO4 can look the same whenever it's written. So things that you are going to see are tab, cap, syrup, suppository or PR, injection, meter dose inhaler, MDI. We don't really like that very much. Lotion. So you may see them that way. We don't really love it, but some things we have to deal with. Contents of this prescription, it should have the name of the drug and the strength of the drug. So Nexium 40 milligrams. You need to be familiar as a healthcare worker. Those top 300 drugs, that's why I gave them to you. So you're familiar with the drugs. It does not have dosages on there, but you'll get real familiar with dosages while you work. Like 20, 40, 60, 80, and 100. Lasix comes in 20 milligram units for the most part. Amlodipine, which is nifedipine, comes in 5 milligram doses. Morphine comes in 10 milligram doses. That's PO. And it can come in 2, 5, and 10 milligram tabs. Hydrochlorothiazide comes in 12.5 and 25 milligrams. Those are just common things that you learn as you go along and you get used to dispensing drugs. But if you are ever concerned, there are tons of references in a pharmacy. PDR, the Orange Book, the USP, they're all available. Utilize them if you are unsure about something. And sorry, that's wiggly. Sorry about that, guys. I almost fell. So just be sure that you use your references. And if in doubt, clarify it with the provider. There's nothing ever wrong with clarifying things with a provider. Now, also, when weight-based dosing is needed, you need to make sure that the patient's weight is converted into kilograms. So the doctor may write a prescription for 12 milligrams per kilogram per dose to be given 3 times a day. Be sure that the patient's weight is on the prescription. If it's not, send it back. So be sure that if it's a liquid concentration, that it has the number of milliliters or ounces that's needed. Be sure that that the concentration and the dose is there. So Caflexin's suspension, 125 milligrams per 5 milliliters, 1 teaspoon, which is 5 milliliters every 8 hours. That would be the example of a good body to the prescription. Now, the other thing we have to be real concerned about is decimal points. We do not have trailing decimal points. If it's 5 milligrams, it's 5 milligrams, because 5.0 can be really easily mistaken for 50. Same thing with whenever we have a decimal point, we want to put the 0 in front of it, because 0.8 can be very easily mistaken for 8 milliliters. So be sure that you do not have a trailing decimals, but that you do have a 0 before the decimal point. If not, clarify. Be sure your provider is writing the prescriptions appropriately. You don't want to be the one dispensing 50 milligrams of a drug that you only should have been given 5 for. Quantity of the drug. The prescriber should put on there the number, either the number sign and 30, or write that out as 1 month, or write it out as, and I've seen providers write out the pound sign number and then write out 30 in words. If it is a controlled substance, they have to write out 120. Has to be written out in Texas. Also, rules for writing quantity. Quantities of 1 gram or more should be written in grams. Write 2G, 3G, 1G. If the quantity is less than a gram, it should be in milliliters or milligrams, depending on what you're doing. Less than 1 milligram would be a microgram or nanogram. Generally, it's written in micrograms and milliliters. Okay, so just be sure that the unit of measure is there that you need. Now, also the directions for use. The directions for use should be on there, like 30 milligrams, 1 tab, PO, 3 times a day. It should tell the patient how many times they're going to take it in a day, and for how long. Sometimes, like they're going to take 3 times a day for 10 days with an antibiotic. So it should be clearly indicated. Atenolol, 100 milligrams once daily. Amoxicillin, 250 milligrams, 3 TDS. I would not take that. Times a day. 250 milligrams TDS times a day. I'm not taking that. Once daily is okay. TDS, not taking it. And then these are Latin abbreviations that you may see. I'm not worried about you guys getting these, because generally they don't use these. Just know that the abbreviation and the English, and we have been over quite a few of those. So be sure that those are the ones that you're familiar with. We hope that they are not using a lot of these. We don't really like those, especially the ones in red. The contents of the prescription, that tells whether or not we can, which is the last piece at the bottom, and it determines whether or not we have to give the trade name or the brand name or the generic. Is the brand name better? Not in all. In most cases, a generic is just fine. There are some medications like warfarin, Synthroid, certain medications that we don't. If they start on the name brand, they stay on the name brand. If they start on the generic, they stay on the generic. We try not to interchange those. But the doctor has to determine whether or not it is okay to substitute a brand name for a generic. And that would be, generally there's a box that they check. Or there's a little statement like this: when a generically equivalent drug product may be dispensed unless the practitioner handwrites the words brand necessary, or brand name only, or brand medically necessary. But for the most part, like he's written here, brand necessary. For the most part, there's also little boxes that they check, or it will come up electronically on the box, not to substitute. And it also has the refill section on there. Indications: it's encouraged but seldom practiced to help confirm appropriateness of the medication. So another thing, if you can encourage why it's indicated, like hypertension or for pain, everything you do to be billed has to do with ICD-10 codes. And we will talk about some ICD-10 codes here very shortly, just so that you guys are familiar with some of those. But an ICD-10 code for back pain is important because that's how you bill the insurance. So the insurance company, it saves, when that's written on the prescription, it actually saves the patient the doctor and you guys a lot of time. I know before I left the clinic I was working at previously, we were trying to get providers in the habit of linking disease processes, which would be their ICD-10 code, to their prescriptions. Therefore, when it went to the pharmacy, it automatically added that to it in the prescription, which saved a whole lot of time. So, and it saved a whole lot of headache. So if you can work with providers or get your pharmacist to work with providers to do that, it saves a lot of headache. And the closing, it should have the prescription signature, the refill instructions, and like I said, once again, if you can substitute for a generic. So closing has the prescription, the provider's signature, and depending on the schedule of the drug, it may or may not need an ink signature. If it's a Schedule 2, it needs to have its own specific Schedule 2 prescription pad, and it has to be handwritten. Schedules 3, 4, and 5, 3 and 4, and 5 Schedule 3 and 4 can have a handwritten signature that's written above a electronic signature, and Schedule 5s generally can have an electronic signature. Antibiotics can have an electronic signature. So, because they're authenticated by the software. So just know that it should have the prescriber's signature, refill instructions, and if it can be substituted by a generic. Refills, generally, you do not accept refills for more than 1 year. I don't know that I've ever seen anything prescribed more than 1 year. Patients should see their provider. So after 1 year, you should not receive refills, and that's a red flag that a prescription is invalid if there is more than 12 months on it. Refill through 2/20/2019 for my blood pressure medicine would be fine. Refill of Xanax, which is they should see the patients at least every 6 months, shouldn't be refilled for a year. Those controlled substances, doctors need to see them more frequently. A Schedule 2 drug like hydrocodone, they have to see them every month. So there are different schedules on how often they should be able to fill those. You should never get a Schedule 2 prescription that has refills on it. It's invalid. So you contact the provider. And always contact your pharmacist and say, hey, I don't think this is a valid prescription. What do you think? You guys talk about it. And then whatever your protocol is for contacting the provider if you have a fake prescription. Controlled substances, we've talked a little bit about them. They require more strict prescribing practice. The definition of a controlled substance is a drug whose use and distribution is tightly controlled because of the risk of abuse or potential addiction, and it is very strictly regulated. So prescription for controlled drugs must be completely written in the prescription's hand in ink. They must come on a Schedule 2 prescription pad, and it must be in the prescriber's handwriting and written in ink. Now, it can be printed so that it's it's legible, and then the physician signs it, but it should be written in the prescriber's hand and in ink. It should be signed. It should be dated. It should have the carrier's address, the name and address of the patient, the state, and state the form of the drug, and the total quantity of the drug. So hydrocodone 500, 1 PO, 3 times a day, number 240. It should be very clear. It also, in the state of Texas, they also make sure that you write the number, and you have to write out the word also, but also in the state of Texas, you have to fill out the date the prescription can be filled. So the prescription is dated at the top, but on the bottom it will have date to be filled. It can't say today, it has to have 2/20/2018. So it has to have the date that the prescription can be filled also in Texas. They can't just bring it in without anything in it. So this is a prescription. It looks like 3 QAM dispense 200 and maybe 70 10 milligram tabs No idea what that is. If you got this, you need to send it back because you can feel the wrong medicine real quick. Poor handwriting contributed to a medication, and these are true case studies. Dispensing error that results in the patient with depression receiving an anxiety medicine of Buspar instead of Prozac. I would have never thought that was Prozac. So the patient got the wrong medication. And in the end, the fault is the pharmacies because they didn't clarify it. That looks like I don't know, 20 milligrams, number 30, no idea. That's going back. So a hypertensive patient received Vantin 200 milligrams instead of Vasotec. Yeah. So once again, if you can't read it, send it back. Always write, so always make sure the writing is legible. Always make sure the words are spaced out where you can understand and read it. Make sure the prescription is complete. If there are abbreviations you don't understand, send it back. And when in doubt, always verify. Verify, verify, verify. Don't put your patient at risk. Just verify the prescription. Clarify the prescription. Okay, contents of the prescription, it should have the date of the order, the patient's name, address, the name of the drug, the strength of the drug, the quantity of the drug, the directions for use, the practitioner's name, address, and telephone number should be printed at the top. And then also, there should be a signature at the bottom. So this would be a model prescription. Doctor's name, today's date, the age of the patient. At the top, it's going to have their heading. At the bottom, and then it's going to have what the actual drug is and what the diagnosis is, which is even fabulous. And then then the provider's information and signature at the bottom. All right, guys. So those are the important things that you need to be sure you're aware of when it comes to prescriptions. Review those notes, and we will get back. I'll see you soon. Thanks, everybody.